Welcome. We would like to welcome and thank everyone for joining us for another one of our Go Red Lunch and Learn informational sessions. We also welcome any students that may be joining us as well. My name is Shirley Oliver, and I am the Data Coordinator for TECTA. I am also a member of the IAC Committee, which stands for International Affairs Council. And within that council, we have the Go Red campaign, which I'm a member of that committee as well. I am one of the hosts for today's Lunch and Learn. Also, we have Kevin Davis, who will be co-hosting with me, and he will be closing us out once our presenter has concluded her presentation. So I'll give you a little bit of history. For those of you who do not know, our Go Red at Southwest campaign is a campaign to promote and educate the Southwest community about heart health. Partnered with the American Heart Association, the campaign is aimed to raise awareness about America's leading cause of death, and that is heart disease. A special thanks goes out to our generous sponsors, Blue Cross Blue Shield of Tennessee and Cigna, for supporting our activities and for providing funding to make Go Red Southwest employee a free program. Thanks to also to our IAC committee for leading this effort, and Human Resources for facilitating. So in the past, we've had several events during the Go Red campaign. We've had Zumba, we've had line dancing, and last month we had our first Lunch and Learn session on heart attacks and strokes, and that was very informational. We had two great speakers, really gave us some very helpful information. Today's Lunch and Learn will be on heart health and mental health. We have our very own Southwest mental health counselor, Kimberly Weddington, who will be presenting and sharing with us some helpful information regarding mental health. We also have Phoenix Worthy, who will be introducing our speaker. We will have a few questions at the end, so you can drop it in the chat, or you can use the little hand feature. Just know also that Kimberly is not a medical doctor, so you will be directed to consult with your physician to get more information. So before we begin with the presentation, we would like for everyone to turn off your cameras so we can have the full presentation from the presenter. Also, if you can mute, everyone can mute yourselves, we would appreciate it. So I think that's all for me. I'll give it to you, Phoenix.
Greetings, everybody. My name is Phoenix Worthy. I serve as the Director of Student Development, where we provide student leadership opportunities and student engagement opportunities for students. More importantly, we also have social services and counseling within our department, and those services are free for our students that are currently enrolled here at Southwest. Our guest speaker today is one of our mental health counselors here at the school. She is a hardworking, compassionate, and dedicated professional counselor. She's highly effective at engaging with clients with a positive regard and active listening skills in order to foster a therapeutic relationship. She received her BA in psychology in 2007 and her MS in professional counseling in 2012. In addition to her counseling duties, she oversees our Mom's Achievement Center. At this time, I introduce to you Ms. Kimberly Weddington.
Thank you, Mr. Worthy.
Welcome.
Okay, bear with me, everyone. I just want to make sure that you all can see my screen. Okay, thank you all for joining us today. So the goal of today's presentation is that you are to learn how mental health affects your heart health, and you should learn coping skills on how to manage your mental health and to decrease cardiovascular disease. A brief disclaimer before we get started. My colleagues were very good at making a good medical disclaimer for me. So I just want everybody to take the time out to just read this for 1 second. This here is my contact info for anyone who wants to ask any questions afterwards, and for anyone who wants to make referrals for students for counseling sessions. Okay, so going right in, this is some basic principles of cognitive behavioral therapy. We call this the thoughts, feelings, and behavioral model. And based upon this model, any type of situation, whether it's unexpected or unfavorable, can happen, and it triggers thoughts. And there's this saying that we see things through rose colored glasses. And that means we see our world through our eyes. Not anybody else's first, but through our eyes. And so based upon those type of thoughts we have, and for the purposes of this presentation, I'm basing it off negative thoughts, like anxious thoughts, worried thoughts, those thoughts that go along with anger. We have certain type of feelings, and our feelings trigger physical responses or bodily sensations like upset stomach, heart racing, diarrhea, headaches. And based off of those physical responses, we have behavioral responses such as isolating from people, throwing temper tantrums, drinking alcohol, and smoking. Now, on the right side of my presentation, you see a more in-depth outline of the TBF cycle. And it just shows you that the TBF cycle just kind of keeps itself just going and going, and it's just ever-ending, just vicious cycle, because based upon your behavior and what you do in response to your thoughts, it just spurs just some more unattended situations or unfavorable situations. And based upon that, you keep having thoughts, you keep having more feelings, you keep doing more behaviors. It may be something else that you may be shameful, or something else just comes up again, and it just keeps on going and going and going until you do something that finally breaks it, that's more healthier, or is better, what we consider better coping. Okay, so this slide here is showing you how the symptoms of heart disease and depression fit together in the TBF cycle, and how they continuously loop together and influence each other. And so for this slide, I'm just showing you how panic disorder and anxiety disorder do the same thing in terms of heart attack. And on the left side, it's just kind of showing you how panic disorder and anxiety disorder, they do have some subtle differences, and there are some overlappings. Big thing is anxiety and panic disorder are not going to kill you. Just in your thinking, when we talk about thinking with those rose-colored glasses, you probably feeling like anxiety disorder is going to kill you. But on the right side, which is colored red, purposely, a heart attack is a big deal. When you have those symptoms, it is leading up to something that will kill you. Now, on this slide, I'm outlining you the big differences between a heart attack and a panic attack. And as you can see, symptoms of heart attack, they radiate, from your neck to your back. You have that pressing symptom in the middle of your chest. It feels more heavier. It feels like something is walking down on you. But the most important thing that I want you to remember is, if you're having these feelings and if you're not sure, please go to the emergency room. Don't try to take it upon yourself. Don't say, well, oh, I lay down, it'll feel better. If I breathe, it'll feel better. It may or may not. Just go get help. Okay, so now let's debunk a myth, because sometimes people just say, well, broken heart, it's stupid, it's petty. Somebody broke up with somebody. They need to get over it. It's puppy love. No, it's not. Yes, it's real. And it's just like any other, you can really consider it a mental health and a physical health disorder, because something that you feel so strongly and passionately about triggers you, it'll set you off and it can possibly kill you and it really hurts. And I give you actually a real life example here. This was a classic camper that and excuse me, this was a classic example and it was an impactful example because everybody is familiar with Debbie Reynolds and Carrie Fisher. Carrie Fisher starred in Star Wars. Debbie Reynolds passed away from a stroke after her daughter Carrie Fisher died from a heart attack. And ironically, which I'm going to go over this in a moment, this occurred during the winter time. And just a side note tidbit, I do have a caption of Only of a Broken Heart. If anybody didn't catch that, that actually came out of a rock song by Yes. It's called Owner of a Broken Heart. Okay, so now we're moving on to migraine disorder and how it relates to cardiovascular disease. I think just about everybody in here, their mom, their friend, brother, cousin, uncle, whoever has suffered from a headache or, more much worse, a migraine. A common response to stress is experiencing a migraine. You hold all that energy of all that stuff that you're not dealing with in your head and it hurts. And one of the major dire risks of having a migraine is your increased chances from suffering a stroke or other heart disease. They say that you're your closest to having a stroke when you're having a migraine. The risks of having a stroke when dealing with a migraine are even higher when you suffer from a hemiplegic migraine. And just with panic disorder, it's even harder to determine the symptoms between having a stroke and having a migraine when you're a hemiplegic sufferer. Okay, so now we're going to go on to talk just briefly about coronavirus and heart disease. And when we think of that TFB cycle, at the start of it, if you want to talk about those triggers and those thoughts and those feelings, well, COVID causes anxiety, it causes grief, it causes depression, it sets you up for trauma. When you talk about your mindset, when you talk about your functioning. COVID causes fatigue, it causes cog fog, and your physical state. COVID causes inflammation, it causes blood clots, it causes irregular heartbeats. COVID can cause these things during the infection, and COVID does not necessarily just let you go. Like, it's just like, well, you're done, you're over it. COVID has lingering effects at least after 1 year. I know some people today that are still bothered with COVID infection. So it's just a endless loop because again, you have to think about what people's thoughts are, what feelings that they're having, those behaviors that they're having, and you have to think about what's going on with that anxiety, that depression, and how it's affecting their heart. So it's just a never-ending spiral. Okay, so now we're moving on to increasing our coping. If you don't remember anything, I would like for you all to remember please. And please is just a simple acronym based off of dialectical behavioral therapy. And so the PL part is just please treating your physical illness. And that involves going to the doctor, taking care of your medications, balancing your please goes with E too. So P goes with E and eating a healthy diet. A is avoiding mood altering substances. S is in for sleep. E is in exercising. And so some of the things with that, you have to think about, are you drinking the proper amount of water, when you're taking your meds and you're eating healthy? Some people don't like water, but when you talk about your health, you're diabetic, you have high blood pressure, if you have other illnesses, I didn't learn this until I started working in an addiction treatment center for several years. It's not something that you can really find in the books, but I just learned this from a psychiatrist. You don't just sip a glass of water to swallow your medication. You have to give your body something to work with. You've got to really drink an 8 ounce glass of water for the number of pills that you're swallowing. For some people, that might be a lot, but you have to have that mindset. Do I want my body to function, or am I just kind of living in denial and I just want to get by? And for other people, so now where I say this is where you have to consult medically with your doctor. You have to understand what's the required amount for you. For some, it may be, those eight ounce glasses. Some people, it may be your water with your weight. But you have to get with your doctor and know, because if you have kidney disease and you have diabetes, high blood pressure, that's not good. Your risk for heart disease goes up. You have to make sure you get proper amounts of sleep. If you're not sleeping anywhere from 6, to 8 hours, and sometimes we need more, you're not functioning. You're not functioning very well mentally. Physically, you're not functioning very well. That leads to obesity. All that fat's just accumulating in your gut, and you make poor decisions. You just comfort eat, and that leads to heart disease. So those are just some of the things that we just have to, keep ourselves in mind about. Now, specifically, when we talk about eating, you just have to take a mindful eating approach. That means just not eating because we're feeling emotional. That leads to just eating a lot of sugar. Eating a ton of sugar is not good for us. You don't want your sodium in balance. You don't want your blood sugar levels in balance. We as students and professionals, we work all day. So you have to ask yourself, are you actually being kind to yourself and taking your lunch breaks? Because you don't have to be diabetic, but you can bottom out your blood sugar, and that will make you feel dizzy, and that will lead to low blood sugar, which will just make your heart rate pump up and work really hard. It'll make you feel like you're going to pass out. And you don't want to keep just doing that time after time after time again. So it's really important that you eat regular. Um, you also want to just walk away from the computer and really just focus on what you're eating, because people tend to eat from convenience when they're not really being mindful of their lunch breaks, and they're not taking into consideration their calorie intake, if they're really eating the right amount of foods, if they're eating healthy foods. And, they're not taking in things with preservatives, because a lot of preservatives cause migraines. They lead to clogged arteries and things. Also, when we're working in an online environment during COVID, and you're doing a lot of talking because we sit down and do meetings, it's good to have a snack or to have something to drink, because sometimes we have what they call like a therapeutic hangover in terms of really talking to people a lot, more common with therapists, but it can occur when you're just sitting down having a lot of meetings, and you start to bottom out your blood sugar and get real tired because you're sitting. It's a sedentary lifestyle. It's good to sip on something and to be able to eat on something so you can get that pickup. So just be aware of your body and the adjustments that you need to make, and just stay on top of your health. Okay, so now we're on some special precautions just to take during the winter months. Some people are not aware of this, but the cold brings upon special things that can occur, and temperature change does affect your mental health. It's ironic that this mental health diagnosis is called SAD, or seasonal affective disorder, but it triggers feelings of depression. There's less sun outside. And when you think of that TFB cycle, people start to get more depressed. They start to feel gloomy. And you kind of get that mindset. don't want to go outside. This is never gonna again. Yada yada yada. And so when people start to isolate and they start to think about grief and different things, they start to get bad habits. They start to drink alcohol, they start to smoke, they start to isolate, they start to develop a lot of bad people start to develop a lot of bad habits because of that, and it starts that negative spiral. So you have to be mindful when you start to thinking really negatively during the winter time, especially if you're somebody already predisposed for depression, anxiety, bipolar disorder, especially if you're somebody who already has heart disease, high blood pressure, or any physical ailment. So also another precaution during the wintertime, just something that you may want to be knowledge of in general, is because it's cold outside, your body is going to be pumping a lot harder to keep you warm. And that increases your risk of having any kind of cardiovascular disease. Okay, so just some coping tips for that, since we know we're at that increased risk for mental health and for heart disease. You want to just try to dress appropriately. We do want to avoid the alcohol. I'm not being a downer. I can't speak enough how alcohol can really be a false illusion of your friend. It may feel like alcohol is giving us a good time, but alcohol is nothing but pure sugar. It can blow your glucose levels out the wall, or it can bottom you out. Alcohol does make you feel warm, but it is a false sense of feeling warm. Alcohol is really taking energy out of your vital organs and only makes your skin warm. And because of that, you may go outside, or you may not put on proper clothing to keep yourself warm when you do go outside. And you can really suffer some serious damage because of that. I don't know if anyone is familiar of this case that ever happened, but it was a young lady that walked into a freezer because she drank a lot of alcohol while she was taking her seizure medication, but she walked into a freezer and she died of hypothermia. And the sad part about it was her seizure medication already distorts the body's perception of being able to tell different temperature changes, and she added alcohol into that. So while she was intoxicated, she made a very poor decision and it cost her life, and her family has to still deal with that grief to this day. Alcohol in general increases your blood pressure. All that sugar causes weight gain. Alcohol disrupts your medication's ability to work anyway, because your body prioritizes alcohol. Now, if you're someone with dealing with grief during the holidays, and if you get too dependent on alcohol, because a lot of times, a lot of people turn on alcohol, it may be casual at first, and then you get to drinking it a lot. And then you may say, I need to stop. You may decide on your own, I want to stop, or that family member tells you you need to stop. It's not a good idea to abruptly stop drinking alcohol when you're dependent on it, whether that's an addiction or whether your body is physically dependent on it, because you run the risk of what I call the big four, which is having a seizure, heart attack, stroke, or choking on your own vomit. And it does happen. I have witnessed those things. Let's see here. As far as exercising, just some brief tips. Exercise when it's daylight outside to prevent your body from having to do more work than what it needs to do. And even though I give you these standard times here, you don't necessarily have to go by them like it's, in a rigid box. Just do what works for you. But in general, someone's younger can go outside at an earlier time, but an older person may want to wait at 11. And just for the holidays, because depression is more on the rise, just be able to give yourself that permission, respect your boundaries, don't be afraid to make adjustments. Just be realistic, with how you're feeling, and check in with family members, talk to somebody. It's okay to say no. It's okay to do something different. So that is all that I have to say. So does anybody have any questions or comments?
So Shirley, do you see any questions or comments in our chat?
No, I don't. Not at the time. I don't see anything in the chat. Great
Okay.
information. We just had received something that says great information.
Okay.
Thank
Great.
you. Well done. But I don't see any questions.
All right. Well, since we don't have any questions, this will bring to a conclusion our lunch and learn for today. We want to thank our Director of Student Development, Phoenix Worthy, and Kimberly Weddington for this great information and great.
We do have one. We just
One
received
Okay.
a question.
All right.
Can you just review, Kimberly, once more the difference between anxiety and stress?
Oh, I'm sorry. Can everybody see that?
Are you trying to show something, Kimberly?
I was trying to share the presentation again.
Okay. Let me I only see a visual of you right now. I don't see your presentation.
Okay. Okay. You said the difference between what now? I think, were we right here?
Repeat again, Shirley, if you see it. Or the comment. She's trying to locate the slide.
Well, were we here? Because you said stress, and I'm assuming that's the panic disorder and heart attack.
Let me see.
Hey, Kimberly, this is Diana. I asked the question. Yes, I just was a little bit confused. If you could review that for me, that would be wonderful, because I know sometimes we kind of are confused by the difference between a panic attack and anxiety attack. Thank you.
Okay, right here. If you look at a heart attack, where the symptoms are the most on like your jaw, and the symptoms can start in your neck, radiate to your back, and that big circle of a radius where symptoms you have this heaviness, this feeling in your chest. And you see like panic disorder, you're looking at both your arms, whereas like heart attack is usually like one arm, but the radius is smaller in terms of where you're feeling a feeling. If I can go back to the previous slide, let me move this up a bit. There's not much differences in terms of anxiety and panic, because you're gonna have some chest discomfort. But they show you here on the heart attack side, you're gonna have chest pressure. You can feel dizzy and lightheaded. But you see right here, they tell you on the right-hand side, you have the jaw pain. So you have to be careful of the subtle differences, because you can have upset stomach with both of them. And so it's really important that you pay attention to this slide here, because this is the subtle differences between the two of them.
Thank you. I appreciate that clarification.
And also, we have in the chat, if you could share the presentation for future reference. Someone asked that.
That means like you want me to send the PowerPoint out? Is that what they're referring to? Okay.
Yes.
So let's ask Diana. Diana, can we share Kimberly's PowerPoint for those who are interested?
Yes, we're going to be packaging the presentation, and we'll make it available on our Southwest College YouTube channel. And we'll be able to, when we announce the next Lunch and Learn, we'll be sharing that link so everyone can actually click on that link to both our previous Lunch and Learn on heart attacks and strokes, as well as this Lunch and Learn on mental health.
Okay, I have a question. Kimberly, on the broken heart syndrome, there's a clinical term for it. Could you go back to that slide and show us that and tell us how to pronounce that, please?
Okay, sure. Takotsubo cardiomyopathy.
Okay, thank you.
Okay.
So instead of saying we got a broken heart, we can say we got Takotsubo.
Oh my gosh.
Or a person like Takotsubo. Cardiomyopathy. It's not funny, but I'm just saying it's.
I get it's cute that you're trying.
It's a clinical term.
It is.
Okay.
Okay.
Are there any more questions?
I don't see any in the chat, or I don't see anyone with the hand feature. So.
Okay. Well, our Lunch and Learn was supposed to be a 30-minute presentation, which it has been. And we want to thank everybody for attending it. Thank you, Phoenix Worthy, our Director of Student Development, and Kimberly Weddington for the presentation. Thank you for all your participation, for all of our fellow colleagues and students who are attended this today. Thank you.
Thank you.